So I'm going to begin the physical examination for the musculoskeletal examination. And at first I'm going to be looking at the hands, and I'm looking at the hands and I'm inspecting for any erythema. I'm looking for any redness. I'm looking for lesions. I'm looking to see if there's any masses. And then I'm going to palpate the hands. I'll be palpating the hands, and I'm feeling for nodules, and I'm feeling the knuckles and all the phalanges, and I'm looking for any masses, any prominence that I feel for like arthritis or so now I'm going to do the extension portion of the hands. So I'm going to ask the patient to extend his hands like this and extend them to the ceiling. And then I'm going to ask him to do flexion, and we're going to point those hands down. And then I'm going to be looking at the fingers, and I'm going to have the patient do some abduction. So abduction is whenever we go away from the midline from the body. So I'm just going to ask the patient to do his hands like this, out like that, and I am going to try to close his hands, and I'm just going to ask him to meet my resistance and not let me close them. And then adduction is adding to the body. So I'm going to ask the patient to have his fingers out again, but close them like that. And then I'm going to ask him to open his fingers, and the same thing for that side. And now that we did the hands, we're going to do the wrist. So we're going to have the patient do some extensions with the wrist. And so I'm just going to ask you to do an extension like this, and then flexion down. And then I'm going to have you hold your hands out again. This is a portion of them. And I'm going to ask you to come up with your hands against my resistance, okay? And then the same thing, go down, okay? And now we're going to do some special tests. So the first test that we're going to do is the anatomical snuff box test. So this is where the patient will hold out their hand and extend the thumb like this, and we'll do it laterally so we can see this. And so ask the patient to extend his hand and make this right here, and then I'm going to press my thumb in this depression here and see if the patient has any pain. And I'm going to do the same thing to the other side. So make sure that we can see that. And I will be going in this depression right here and seeing if the patient has any type of pain. And then I'm going to do some series of tests for carpal tunnel syndrome. So first we'll do the Tennel sign, and this is where we will hyperextend the wrist. So you hyperextend the wrist and you press over between your line. Okay. So I'm going to ask you to do this right here, and then I'm just going to percuss between the radial and the ulnar aspect, and I'm just going to do some percussion right here and see if the patient has any pain. And I'm going to do the same thing to the other side. see if the patient has any pain with that. And then I'm going to do the fan lines test. And this is where the patient is going to put his hands in a prayer position like this. And then I'm going to have the patient just hold that motion right there for 30 seconds and have him do it pretty close together and pretty hard together. And we will wait 30 seconds. And if the patient has any numbness or tingling, then that could be suspicious for carpal tunnel syndrome. So I'm going to ask you to release. And then we're going to do the reverse prayer. So I'm going to have you do your hands like this right here. And make sure your wrists touch. Make sure you can see that there. So we're going to do the same thing. Hold it for 30 seconds and wait and see if the patient has any tingling, numbness, or pain with that after 30 seconds. Okay, you can release. And now we're going to do another test, the median compression test. And this is where we compress the nerve between the radial and the ulnar aspect. So let's see here, make sure you can see this. So we are going to compress those for 30 seconds, and we'll just hold for 30 seconds, and we'll see if the patient has any numbness or tingling when I release that. If you could just relax your hand. And we'll do the same thing for the other side. So we're just compressing these nerves between the ulnar aspect and the radial aspect, and seeing if the patient has any numbness, tingling, or pain with that test. Now we're going to do the Pinnacle Stens test, and this will test for tenosynovitis, and this is where the patient is going to make a fist for me, please. The patient will make a fist, and then I'm going to have you tuck your thumb under your fingers like that. And then I'm going to have you stand like that. So extend the wrist. I'm going to have him extend the wrist this way while I'm on the radial aspect, and see if the patient notices any pain. And we'll go forward like that. We'll do the same thing to the other side. So extend. Is there any pain with that movement?
No.
And now we're going to do the Allen's test. And this is for blood flow. So I'm just going to have the patient make another fist. And then I'm going to occlude the radial and the ulnar arteries, and then I'm going to have the patient open your hand, and I'm going to release the radial aspect and watch the blood flow back in there get nice and pink. And then I'm going to have you do the same thing, do another fist, and I'm going to do the same thing again and have the patient open your hands, and then I'll release the ulnar aspect and watch it turn back pink. The blood flow goes back pink. And that's the Allen's test. Now I'm going to work my way up to the elbow. And the elbow, I'm just inspecting, and I'm going to palpate. I'm going to palpate for the ultranon process, which is like, let's see, which is back here, this prominent back here, and I'll palpate both of those. And then the epichondrial aspect, and then I will do let's do some flexion and extension. So flex your elbows like that, and then extend outward. Like that. It's hard to get both of them. And then let's do pronation, and supination. Okay, and then we will move on to the shoulders. And for the shoulders, I'm inspecting and I'm looking for symmetry, and I'm going to start palpating the shoulder area, and I'm going to find so we're going to find the suprasternal notch, and then we are going to walk the fingers laterally to the clavicle. So I'm palpating the clavicle, and then I'm going to the supinate of the shoulder to the acromion process, and I feel that, and then just medial and then we'll have the AC joint, or the acromion clavicular junction, and then I'm moving downward to the deltoid pectoral groove, and I feel that groove there, and I'm feeling for the coracoid process, and then I'm going to move lateral to the lesser tubercle, and then the greater tubercle. And I will do the same thing for this side. So we do the clavicle, then we do the supinate right here, and then the acromion process, and then the AC joint slightly down to the pectoral groove, and then feel for coracoid process, and then lateral the tubercle, lesser, and then the greater. And now I'm going to move down to the biceptal groove, which is near, which is near the lesser tubercle, and I'll palpate those on both sides. And then we're going to do some range of motion. So I'm going to have the patient lift your shoulders up to the ceiling, and lift them both up. And then I'm going to have you Then I'm going to have you bring them back like this. And then I'm going to do some abduction. So we're going to go away from the midline. So I'm going to have you abduction, so away from the midline, so like a bird. And then some adduction. Then I'm going to have you cross, do like a stretch on both arms, both shoulders, please. And while he was doing the cross arm, that is for the rotator cuff. So if there's any pain or any tenderness when he was doing that, then we could be suspicious of a rotator cuff injury. Okay, now we're going to do some internal rotation with the shoulder. So I'm going to have you reach behind your neck like this and scratch, like scratching the back of your neck on both arms, please. And then I'm going to have you reach behind your back and try to touch your scapula. And the same thing for the other side. And that's some external rotation of the shoulder. Now we're going to do some more special tests, and this is for if there is suspect for a rotator cuff injury. So I'm going to have you extend the arms and supinate your arms like this. Make a fist like this, and I'm going to press down on your arms, and you try to meet your resistance. Okay, and then same thing. You can leave your hands like that, and then I'm going to have you press down. Okay, thank you. So it is able to maintain the position. Actually, let's do that again. Never mind. You already did this. And then we're going to do the nearest test. And this is where I'm going to press down on the patient's scapula. So I got my hand behind the patient on his scapula. And this is the near test. And I'm going to have the patient pronate the arm. And I'm going to have him lift above his head and extend. Let's see. I'm pressing on this, and then I have him lift and see if the patient has any problems whenever I do that. So I lifted that passively for him. And then I'm going to do the Hawkins test. So I'm going to have him you flex the shoulder and the elbow. So I need you to make like this. Like that. And then I'm going to have to rotate the shoulder that way and see if the patient has any if there's any pain with that movement. And then I'm going to do the apprehension test, and this is, we're going to have you lift your shoulder like this, like you're about to throw a baseball, and So then I would hyperextend this way while the patient, I would be doing that because we're doing a passive movement. Slightly raise hand above shoulder, and I'm looking for the apprehension or look of apprehension on the patient's face as I'm doing this. So I'll go ahead and let's do that again. So like you're throwing a baseball. It's so hard to see. Supposed to need to see his face. And so we're hyperextending the elbow and we're just watching his face to see if he had any discomfort. And then we're going to do the drop arm sign. So I'm going to have you drop your arms to your side. Just let it dangle there. And then I'm going to have you abduct, so away from your body and above the head. And then I'm going to have you slowly lower the arm the same way you lifted it up. Okay, so there's no shoulder drop. So now we will move on to the neck. And for the neck, I'm assessing the neck. I'm making sure that the trachea is midline. And I'm inspecting for any bulging or masses or lesions. And we're going to do some range of motion. I'm going to have the patient do some forward flexion. So if you could tuck your chin to your chest. And then I'm going to have you do some extension and look up at the ceiling. And then I'm going to do some cervical rotation. And can you look to your left and then look to your right? And then we'll do some lateral bending. Can you put your ear to your shoulder on both sides? Actually, hold your shoulder still and see. Okay, on the other side. All right. Or we could also do just a neck circle, and that would get the range of motion. You could do that. The range of motion in all those areas. Okay. Now I'm going to ask you to stand and look at the wall. That's good. Yeah.
This is good.
Okay, so here we're looking at the spine and we're looking at the curvature of the spine. So if you could just relax a little bit, relax your shoulders. And I'm starting up here and I'm inspecting the shoulders and the back. I'm looking to see if I notice any scarring, looking for lesions, looking for any deformities, looking for symmetry. So we'll start at the cervical spine. And the cervical spine right here, it should be concave right here. And then we'll go to the thoracic spine, which should be slightly convex. And then we'll get to the lumbar spine, and this should be slightly concave again. Then I'm going to palpate. I'm palpating for the C7. So we found the C7, and we're going to walk down one by one along the vertebrae, and we're looking for any depression and we're feeling for alignment. of the spine as we're walking down the spine. For any depressions or anything to the side. Okay, and now we are going to start palpating the paravertebral muscles. So just palpating these muscles. I'm feeling for any masses or anything that's abnormal. And now I'm going to do a series of tests for range of motion. And I'm going to ask the patient to do some forward flexion. So if you could bend over like you're touching your toes.
This way?
Yes. Bend over and touch your toes. You don't have to go all the way down. Just that you can. There you go. And this, let's do that again and stay there for just a second. And so here, can't really see. So here I would be looking for any abnormalities, and I'm looking for the alignment to identify if there's any scoliosis or any asymmetry. And you can come back up. Okay. And now I'm going to have you come to the side and you can hang. I need to be able to put mine. So here I'm palpating the hips, and we are just feeling to make sure there's evenness, and we're making sure that one hip is not higher than the other. And then can you do a little bit of an extension? So can you kind of do like a little bitty back bend while you're standing there? Back, like back.
Oh.
There you go. That's good. Just like that. So that was extension. And now I'm going to have you do a twist with your hips, and if you could, yep, twist that way and the other way. Good job. And let's do some lateral bending. So, yes, that way and then the other way. And now we're going to move on to the hips while the patient is lying down. And actually we will adjust this and we'll finish up the examination.